Hello, I'm Dr. Richard Mounts, a practicing endodontist and Chief Dental Officer of Vista Dental. Vista is unconditionally committed to providing our doctors and dealer partners with the most innovative and clinically effective products available anywhere. Vista is your endodontic restorative solution. Today, I'm pleased to introduce a simple and ergonomic method to optimize your endodontic irrigation and canal disinfection with the AutoSyringe, Vista's rechargeable cordless irrigation handpiece. It can take a significant amount of pressure to push irrigating solutions through endodontic irrigating needles. The larger the syringe and the smaller the needle, the greater the pressure required on the plunger. Aside from the significant hand fatigue which results from pushing on the plunger, controlling the flow rate and apical pressure of extrusion can be difficult. AutoSyringe eliminates this hand fatigue entirely. The AutoSyringe contains precision piezoelectric micropumps and, as a result, is quiet and yet provides a push-button, operator-determined, slow, medium, or fast flow rate, depending on the clinical indication. The clinician simply selects the desired speed of extrusion by pressing the flow rate button. Once the flow rate is determined, irrigant flow from the AutoSyringe is activated by depressing the on-off button. Battery charge status is indicated by the LED color of the on-off button. Green is fully charged, red is low charge, and blinking red means the battery needs charging. Controlling the flow rate and eliminating undue forces using AutoSyringe provides excellent tactile control. For reference, the slow flow rate extrudes at approximately 2.6 milliliters per minute. The medium rate extrudes at 3.5 milliliters per minute, and the fast rate extrudes at 5.1 milliliters per minute for a 27-gauge needle, providing a safe and consistent flow every time. It is worth noting that flow rates do depend on the gauge of the needle tip. It is common to irrigate with an enhanced sodium hypochlorite solution like Chlorextra and a chelator such as Smear-Off to remove the smear layer. These irrigants can and should be activated. Endo Ultra, Vista's cordless ultrasonic activation device, is an ideal means to activate Chlorextra and Smear-Off to optimize cleaning. Used together, the AutoSyringe, Chlorextra, Smear-Off, and the Endo Ultra provide a high-level, comprehensive, and evidence-based canal disinfection protocol. Preparing the AutoSyringe with irrigants is easy. The AutoSyringe comes with 3 20-milliliter canisters that can be filled with any desired solution, for example, Chlorextra and Smear-Off. The canisters are reusable. The AutoSyringe should be flushed with water after every procedure to purge any residual irrigants. The easily loaded 20-milliliter canisters can be quickly exchanged. This user-friendly feature ensures that larger volumes of Chlorextra and Smear-Off can be dispensed in every procedure and eliminates the waste associated with multiple syringes and needle tips. Simply fill the canister, snap the canister into the AutoSyringe, set the flow rate, rotate the head of the AutoSyringe to the desired orientation, extrude the solutions, and activate when ready. The AutoSyringe comes with autoclavable sleeves and plastic barriers to prevent cross-contamination. The system is highly adaptable because it accepts all standard irrigating tips, allowing the clinician to customize the desired tip to the specific requirements of the canal anatomy being addressed. I use the AutoSyringe routinely. It has become an indispensable part of my armamentarium.